Hi, everybody. So thank you for joining us. And I am really happy to be doing this with Dr. Henry Blest and Andrew Wortmann. And we are going to be talking today about anal douching. So this is like a really common topic that we tend to ignore, or there is some taboo around, but there is so much good education and good information out there. I thought it was best that you guys hear from the experts. So briefly, I'm just going to say, like, I'm Carmen Fong. I'm a colorectal surgeon, also known as your friendly neighborhood colorectal surgeon. So everything but in gut health, I love to talk about, probably ad nauseum. My wife will tell you. She's like, "Why are you talking about this again?" But that's why I'm here, and I really just wanted to uh, be part of this conversation, and yeah, basically give the floor to these guys.
I'm Henry Blest. I previously worked in virology for a long time, but then started Polari Labs with my co-founder, Anna Vibranova. We are totally focused on everything douching. We are actually making an alternative to anal douching at the moment in our lab. We run the only anal sex lab in the world with models showing how rectums work and even how the process of douching can flush feces out of the rectum. And so that's kind of where I'll leave it. And my pronouns are he, they.
I'm Andrew Wortmann. I'm with Cheeky Charity, and we're an organization that's dedicated to all things butt and gut health. So I turn my love of butts into a profession, and it's a chance to destigmatize the conversations around your butts and poop and farts and all of those sorts of things. They're funny you know, at a young age, and all of a sudden there's this weird shift where you don't want to talk about them anymore, but it's so important to keep that conversation going. So that's what we're all about. And my pronouns are he, him. Anal douching is something that is common in the LGBTQ community, and I think it's something that is still taboo, even though a lot of people are doing it. And so I think the three of us are here to break down that taboo.
Yes, absolutely. No. And then also I think I want to, throw in there that part of what Cheeky Charity does is educate about colon cancer, like colon and anal cancer. And so part of the reason why I talk about butt and gut health all the time is that I don't want people to ignore their symptoms, right? So like whether you're douching or not, like if you're suddenly having some anal rectal symptoms that you can't explain and is new, it's always better to get checked out than otherwise. Anyway, so that being said, I have a question before we start going into all of our reader questions. So a lot of these questions are comments that we've gotten on our social media feeds, and we've collected it, via different sources. Henry's also had a very extensive survey, surveying about anal sex practices, and so we've collected the questions that way. But I think we've discussed this in the past, but how many people do you think douche?
Like a number wise.
Mhm.
So I know we from
Mhm.
our bottom up calculations that
Yes.
in the UK, US, and Europe, there are around 5 billion acts of anal sex happening per year.
Yep.
That's in both the straight and the gay
Right.
community. 70% of gay men are known to douche, 30% don't, from the literature. And it's the other way around in the straight community. So 30% of women douche versus don't douche. So I think if I remember correctly, you're looking at around 12 million people in the UK, US, and Europe that are affected by this issue. And within that, a proportion are douching.
Correct. Yeah, no, I think that's always like an astounding number to me, like 12 million people who are doing this. And there's not that much education of it out there. Like imagine like 12 million people trying to do anything else and not
Right.
talking about it.
But I think also it's astounding. People are always shocked at so these stats that we have that they're based on academic surveys. Like
Yeah,
if
true.
you are calculating the total number of anal sex acts, actually 5 out of 6 are happening between heterosexual people, not LGBTQIA plus people. So it really does affect the whole of society. It's not just LGBTQ couples.
Yeah, and I think I had read that the absolute number, right, because there are, still more heterosexual, or heteronormative, people than LGBT, it's like 17 million straight women who douche, right? So that's actually more like the absolute number. That's, yeah, I mean, so this affects everybody. All right. So now we'll get into like our first round of questions, and all of us are going to jump in and answer. Here's the question we asked our communities. Do you struggle with douching or have lingering questions about it? Now's your chance to get your questions answered by our anal douching experts. So that's what we asked. And if you still have other questions out there, then definitely like comment, jump in, find one of us on social media, and we will try to get you the right answer. Okay. So the first theme is douching basics and best practices.
So I
It's a good
think I'll
topic.
leave with this one for you guys. I think the other thing that's really good to note is, and is amazing, is that these questions have been submitted anonymously.
Mm.
People are so awkward about this stuff that actually I've already read through them, and it's great to see questions which are like no holes barred.
Oh yeah.
These questions everyone wants to know. So the first question we have on douching basics and best practices is how much water is too much water when douching?
Yeah.
It's
All
less than
right.
you think, I would say, right? I think that's
Yeah.
probably one of the biggest mistakes is people go too much water too quick. I think it's going to vary from person to person, right? But generally, a couple of bulb flushes, or however you're doing your flush, is a good starting spot. You may need more, you may need maybe just one, but I would say start with less than you think you're going to need.
Yeah, for sure. Like I think that people are, trying to give themselves like colonics, and that's not
Right.
a thing as a douche. 2 to 3 liters is a colonic, and you're actually going past the rectum into the sigmoid, into the left colon, and you don't need to be all the way up there. Your rectum technically only holds about like 150 to 180 mLs, right? And so, I mean, it can expand a little bit more beyond that, but a regular like syringe, like a 60 cc syringe, 60 ml syringe, probably a couple of those, like Andrew said. Right. What do you think?
Yeah, I mean, I totally agree with that. I think the other thing is like if you so basically if you push past, so your rectum is long, and then you have the rectosigmoid junction, which is an area of pressure. If
Yep.
you push the water past that area of pressure, there'll be loose stool further up that will be brought down, and you're probably making your life a lot harder than if you're just clearing out the rectum itself.
Right.
But I did also notice, because I tried to find a douche that is that small. It's very
Hmm.
hard to find a douche that is actually 50 ml. Almost all of them, the smallest ones I can start at 89
Mm.
ml. So
Right.
room for innovation.
That's good to know. Yeah. Yeah.
Yeah.
So
But
like
I
how
think,
much like when people are
oh,
using like a fleet bottle or something like that, like how should they measure a squeeze? Like how do you
yeah.
guesstimate, that amount?
So I've literally got one here. It's 230 ml. So that's like 4 times as much as you want. So you only want to do a little squeeze. So this is actually already too big. But the one thing I can say about this is it has the flexible tip.
That flexible tip is, I was saying, is doctor approved, and the only one that I like of all the ones that we tried.
Mhm.
But yeah, so even this, like one squeeze generally will squeeze about half of it out, so it's like a gentle squeeze. We really need to do a model. I know you guys are working on the model, but we really need to show, I think the confusion is between the rectum and that rectosigmoid junction. Like if you,
Mm.
because there's another question later on that I think is very similar. Like
Mm.
why doesn't poop just come out all the time? Anyway, we'll get there.
Mm, makes sense.
I'll ask the next question on this first portion, which is it really bad to douche every day?
Yeah. I don't think it's bad, but I think it's unnecessary, right? And even if you're having like sex all the time, which good for you, I don't know that it's totally necessary to douche all the time, because you don't always have stool in your rectum, is part
Hmm.
of the answer. The second part of the question is the every time you douche, you're actually clearing out some of the good bacteria that's in your rectum and colon. And so that is the number one reason I don't recommend doing it all the time. You're clearing out the good microbiome, you're causing some mucosal, trauma and injury to the inside lining of the rectum. And a lot of times, what happens with any kind of mucosal lining is that, either whether it's your rectum or your mouth, for example, if you're irritating it too much, it actually produces more mucus, right, to kind of protect it. And that's why when some people see this effect of being like, hey, I see all this mucus coming out all the time. Like, why? It's because it's a little irritated.
Perfectly said.
Could I
I'd also
ask
say
you?
like it
Sorry.
well, I guess I will say like if you find yourself needing to douche, like if you feel the need to douche every day, like it might be a fiber issue also, like if you are feeling like things aren't passing naturally or like you're always dirty, like the magic of fiber is wonderful. Like it'll go, things will smoothly pass more easily.
Yeah, no, that's an excellent point. I think when you're pooping well, like the rectum should be pretty much clear.
Right.
Next question, actually, which is water versus special solutions. What do we think's better?
Ooh, I know Henry has a good answer to this. Um, but we think tap water is best. Like room temperature tap water is usually the best. You're not adding any additional chemicals to it. You don't need to do anything fancy in terms of like saline or pH. It's not too hot or too cold.
Definitely don't use the Fleet solution.
Definitely.
You'll be pooping for a
Oh my God.
lot longer than you
Like four
intended to.
days. You don't need that at all.
Yeah.
Yeah.
Yeah, I think in general, laxatives and congestants, absolute no-no. Really worrying rise in people using Imodium in the UK to kind of bung themselves up. Um, yeah, I
Interesting.
mean, again, we think water's the best.
Yeah.
Some people recommend saline solutions. But I think that the biggest no-no is anything that, some people go, I've heard of more extreme cases of people putting soap, etc. Absolutely not.
Yeah.
The worst thing you could possibly do for yourself.
Yeah. I'm always saying, don't put anything in your butt that you wouldn't put in your mouth. And soap is a big no inside. And why not Fleets? Like, so Fleets has a lot of electrolytes in it, electrolytes that you don't actually need, and the electrolytes act as a stimulant laxative, a stimulant and osmotic laxative. So it really is making you poop a lot more than you need to, and you're really just trying to clean out that bottom part, that rectum part.
And on that note, Carmen,
Right.
that brings us on to, is a shower head attachment okay to use?
Oh, I have so many patients who use this, and so then therefore it has to be okay. But I do think it can be a little bit harsh, and I do think that sometimes it's a little strong. From what I've seen, I definitely see some mucosal injuries from using the shower head. So either too hot water or the water is too strong.
Mm.
I'd say it's not an ideal attachment for a novice doucher.
Yeah.
Something that after you maybe know what you're doing a bit more, you could use something like that.
Yeah, and it's a little complicated and it's not readily available, so I really don't know that it's ideal unless it's like somebody has it all the time. They also have those like, shower kind of attachment bidets. Have you seen those? And
Hmm.
so
Mm.
I've had people tell me that they use that instead, and that's a little bit different because that's not going as far into your, rectum. Um, I don't know that I could even comment on that. It works great as a bidet though.
Mm. I think also with this, like I've never used one. That kind of not yet, but I think one of the things I think is the most worrying is firstly pressure of the water and more importantly temperature of the water. You want the water to be lukewarm.
Yeah.
And obviously with shower attachments, you can't always have total control over pressure and temperature. I think I heard of one person getting during surveys getting quite horrible internal burns
Yeah.
from water temperature not being consistent in the house, someone turning on the tap in the sink and it all going wrong. I think that's why I'd be quite careful. But if you're kind of doing your, you know, missionary or like very just normal penetrative anal sex, really you shouldn't have to be clearing up beyond the rectum. So I think most people should probably steer away from the shower attachment.
Yeah, I'm gonna say no, like as a general rule. I definitely have had one patient who told me that he just turned the water up as hot as he could, actually, because if you're trying to clean something, like hot water seems better. But it's completely counterintuitive because it does, burn the insides a little bit.
Yeah.
Yeah.
You're aiming for like your body temperature in terms of the water temperature, right? Like you're not looking for anything scalding.
Yeah, body temperature or even a little bit cooler.
I mean, your rectum is not like doing the dishes. So hot
You're not like
water,
blasting it.
good for dishes, not good for your anus.
My God. I just had a spoon melt in my dishwasher, which I didn't even know could
A
happen.
metal spoon?
No, like a plastic spoon, like my kid's spoon. And I didn't
Okay.
even know that could happen. And I'm like, wow. So,
Crazy.
imagine. Very good
Yeah,
analogy.
that's scary.
Yeah, no. I was like,
The
what is that smell?
um, and we have our next question, which is best douching tools for beginners versus experienced users.
Yeah, so not the shower attachment.
Right.
We talked about a couple, like the Fleet bottle, I think for the tip is a good tool to have. A big syringe, if you're looking to control the amount of water that you're using. The trick at that point though is attaching, the Fleet attachment to the syringe or being gentle enough with the syringe that you're not hurting yourself unintentionally. But I mean, for me, it was like the Fleet bottle was the safest starting point. If you're worried about the amount of water, don't fill it up all the way, maybe, and you can control it a little bit easier that way. Um, but I would start there.
Totally agree. Fleet bottle or a bulb
Hmm.
syringe is usually the easiest, like a turkey baster.
So because we all love this so much, I bring a little demo, which I thought was quite a good rule of thumb, for, like choosing a douche in this context, which is basically like if the douche, like this one, can go into an apple, my God, it's just hit
Mm.
me then
Oh,
then that douche could go through your rectum.
yeah,
Whereas, like, just to illustrate with the Fleet, it is designed
yeah,
not to go through the surface. So our
yeah.
new device is if it will go through the apple, don't use
That's good advice. Yes.
It's so funny because I totally brought my butt model too, with like the little butt
Yes.
hole. I mean, I have different models, but I just wanted to show like the length of the actual anus because people are always like, how long is the anus compared to your rectum? And this is really just anal canal, right? So your anus is about that long to like,
Mm.
most people are between 6 and 8 centimeters. This is anus, and anything a little bit above that is rectum. So you really, don't need to go any further than that, right? If you just go a little bit further, it's going to get into the rectum and kind of squish back out. And that's as far as you need to go. You're not trying to get into your colon after that. Yeah, 6 or 8 centimeters. I need like a ruler. That would be.
Um,
More people need butt models in their lives.
Oh, I know. Like I just have these things laying around and everybody's like, what is wrong with them?
our next question is when to douche before sex and how long to wait afterwards.
I think it's also going to depend a little bit on the person and like maybe how much you have in your system at the time, but generally like an hour or two, I would say, is a safe window. You'd give yourself time to not be actively douching and let anything kind of run its course, if needed, and for things to settle back down before you insert
Yeah.
anything else, right?
Yeah. No, that's perfect. I was going to say about 90 minutes, like about an hour and a half, because that's really how long it takes for, from the time you eat, it's not the same food that goes into your rectum, but it's like, yesterday's food that's going into your rectum. And so that takes about 15 to 90 minutes. So anywhere about 90 minutes, you're actually getting everything that has moved into the rectum and is going to be immediately coming out. And so if you do a little bit less time, you might get everything that's there at the time, but not everything that might move down in the next cycle. Does that make sense? I don't know.
Yeah.
Yeah.
Great. And with that, we'll move on to our next section, which is body knowledge and hygiene science. And I'll let Andrew ask the questions on this one.
Yes. So the first question is about diet, and drug use and the impact of those on douching. So I mean, everything starts in the gut, right?
Yep. Yep, I would say it's pretty huge, and I think like, not negligible at least, that if you have a good high fiber diet, you drink plenty of water, you're relatively active, your bowels are smooth, and you go daily or even every other day, and everything comes out as expected, you're clearing yourself out and not having to worry about residual stool in your colon that might come out during the douche. Drug use is an interesting one. So, I mean, recreational drugs are a little bit, unpredictable, and so I'm gonna say that, stimulant drugs, will actually cause you to go more, have more diarrhea, versus like opioids are gonna make you constipated, right? So there's that. But then even just regular medications can actually impact your, right? And this is more common, obviously, can actually impact your bowel movement. So things like taking a lot of Tums or a lot of heartburn medications can constipate you. And so you might have more stool sitting in the colon. And then we obviously talked about Imodium, right? So taking Imodium to stop you up will stop the stool as well. GLP-1 agonists, which are huge these days. And I wasn't going to touch on this, but I guess I will. Because of, the high rate of like gastrointestinal effects and having, I think it's like 7% diarrhea and 14% constipation, you can have changes in your bowel habits from it. So if you're also thinking about that, you might want to consider like what your bowel habits are going into your douching, your douching period.
I think the other thing I really like to explain to people is actually how we talk about fiber all the time, but how fiber actually works, which is,
Mm.
I think people think of fiber as this kind of stringy leaf-like stuff that holds us
Yeah.
all together. But you couldn't be more wrong. What happens is fiber goes into you like that. It gets hydrolyzed. So the acid in your stomach breaks it up. What it actually does, it then sets into like a really, really clear jelly if you don't have anything else in it. So what it's actually doing with the shit is it's setting all the shit into a jelly, and then that leaves you all in one go in one piece. And that's why fiber is, to be honest, the bottom's absolute best friend, because it just means whatever you're doing, it will
Yeah.
just leave in one piece and leave no residues behind.
Oh, I love that. And with your apple there, that's my perfect example of a good fiber,
Mhm.
fiber containing food, because apples have both soluble fiber in the flesh, like in the pectin, which causes that jelly. And then also in the skin, there's insoluble fiber, which acts as, an irritant, and that's like that leafy, stringy stuff. So fiber, I mean, an apple is really the perfect food. An apple a day makes
Bottom
bottoms really
away.
happy.
You're good. You're good, babe.
We'll work on it.
We'll work on it. We'll workshop it.
What about hydration in terms of diet, um and fiber and the impacts on poop?
Yeah, so fiber without water is just concrete in your colon, right? So that because of that jelly stuff, and like Henry said, it has to be hydrolyzed, so it has to soak in all that water for that stool to become slippery and slip through the colon. And that's what I always tell people. You can eat all the fiber in the world, and if you don't drink any water, it's still going to sit in your colon like concrete. So you have to wash it through, generally two liters of water a day, if not three. If you're like super active, super pregnant, or in like a super hot climate.
Okay, so let's talk about the rectum when you're not pooping. Like what's happening? Is it just empty when you're just sitting there? And like why is poop not just actively coming out?
Yeah, it's empty most of the time.
Yeah.
Uh, it acts as a reservoir for the rest of the colon. And so really what happened, like I said, about that 90-minute mark, 15 to 90 minutes, depending on how much you ate and how recently you ate, um, from the colon, stool gets pushed into the rectum, where it basically sits until, you're ready to go. And that signal, the rare response is your body being like, hey, there's poop there. And then my favorite part about the body is the sampling, where you'll let out a little fart and your body will be like, hey, is that gas or solid? And if it's solid, your body will be like, oh, okay, I'm going to hold it until a more convenient time. Or, if it is a more convenient time, you can go. But otherwise, it acts as a reservoir. It's waiting until you can go.
Yeah, I mean, from the scientists, Neil et al., 1981, they did this ages ago. They could only detect, so that's very minimal amounts of feces in the rectum 30% of the time. So most of the time, the rectum has no feces in it. And also, what's interesting about some of the peristaltic waves, the short peristaltic waves in the rectum, actually the majority of them are moving up, not down. So it may be that the rectum is actually, pushing the feces out of itself. Um, but yeah, so no, there's not normally feces in the rectum.
Makes sense.
Isn't that cool? I think that's so cool.
The
When
body's
I read it,
amazing.
it was
It's
like,
like that it really is. Like the fact that it like is self-cleaning almost. Like it's pretty fascinating.
Yeah, it's like totally self-cleaning, right? Because it empties when it needs to. And then I think it just should be more comforting for people to know that you really shouldn't be walking around with a full rectum. And if you are, it means you need to go poop, right?
the other thing we've realized from modeling anal sex is that because your sphincter is quite a lot of pressure on there, it's like 44 milligrams of mercury, so quite a lot of pressure. Actually, to have feces come out of you during sex is really difficult, even if there's a very, very small amount, because that is just, it's cleaning it off. So people probably there is some feces sometimes that they're not realizing. Um, so yeah, it's actually harder than you anticipate for feces to appear during anal sex.
I imagine you would actually have to like push a little bit. You would actually have to strain to overcome the anal sphincter pressure, right? To get poop to come out if you had any.
Yeah, yeah, I guess so. I mean, I think this motion actually makes it very hard for feces to come out with the penis if there was a
Right.
very small amount
Because
in
there's
there.
already something in it. And yeah, right. No, for
Mm.
sure. So
Along
unless you were
those
trying,
lines, yeah, I
yeah.
mean, like unless you're trying, and I think that's one of the next questions is like along the lines of breathing, mental and physical techniques to stay clean, and maybe not in terms of staying clean, but or douching, but in terms of feces during sex and that fear, I think breathing and being in a space and not and being ready to have anal penetration, there is some breathing that goes with that to be so that it's not this aggressive entrance to your body, right? And so I think, making sure that you're with somebody that can help you through it, and that it's not a rushed experience, I think is super important in terms of staying clean.
No, I think that's like super, super important. And so like being in a relaxed state, like a safe space, right? And you're not
Hmm.
being super anxious about what's going on. And you're
And I
pretty
mean, also, no pressure is really important. If you, for instance, you think you want to go through with something, and then you decide at any moment that actually I don't feel right, this isn't the night for me, maybe because of the situation you're in or something changing. Obviously, you just say no. Um, I mean, it's not easy sometimes to say no, but like always remember you can say no, and should if you're not feeling comfortable. I think the other thing that springs to mind with this is like with like breathing exercises and feeling comfortable is like, for instance, like with the douche that we recommend, this one with the soft tip, some douches will come with a tip that is almost as wide and as long as a penis. There is no benefit to using that to douche. Actually, what you're probably going to do by using such a large object to try and douche is because you're not warmed up already, you're probably going to actually cause yourself some pain, which will then probably make it then harder when you want to have intercourse because you've already, um, you know, annoyed the sphincter on the way in, making it much harder to relax.
And I mean, even when I do rectal exams in the office, and I always just have to like, remind ourselves that the sphincter is a muscle, right, at baseline. And it's actually like a very complex set of muscles in your external sphincter, internal sphincter, and in your pelvic floor. And so if you imagine when you're trying to poop and you're super anxious, your body actually won't let you because everything tightens up. You literally hold your stress in your pelvis and you have to take a couple deep breaths to be like, relax. Like I'm potty training my daughter, and it's like she has to be relaxed to go. And if she's thinking
Right.
about it, actually can't. It's the same thing, during anal penetrative sex. And if it's something where you're not relaxed, it's not the muscle won't loosen. Um, a breathing technique is I tell my patients, you actually take a deep breath, and if you actually push like you're having a bowel movement, it opens up the muscle, it opens up the internal sphincter a little bit more. And for example, will allow an exam and will allow an anoscope. So that's something I always remind people, especially when I'm seeing patients with like traumatic anal fissures. Like you can actually push out a little bit, which opens the muscle, and then take another deep breath in, and it'll be a little more relaxed.
I think another good one I just made me remind me of is with anal pain and people who struggle with it to relax, to have receptive anal sex. One of the good tips is that people actually think that if they are masturbating, it's going to make it easier because they're aroused. But
Mhm.
actually, pleasure and masturbation actually make your anus tighten, which makes it harder. So I think that was one of the things I learned doing all these interviews, that actually it's quite good for people to know that when you're in that moment, if you're trying to relax, don't masturbate, because actually what that's going to do is make it harder for you to relax and let the person in without pain.
No, that's a great one because yeah, your entire pelvic floor actually, tightens during like orgasm and ejaculation. So that totally makes sense.
Going back to diet for a second, can diet tweaks or fiber supplements reduce the need to douche?
I think we kind of commented on that a little bit earlier, but a good high fiber diet, 25 to 35 grams of fiber a day, you'll be having regular bowel movements that might, maybe not eliminate it completely, but reduce the need, or
Mhm.
reduce feeling the need to douche at least. And then on that same token, I would say if you're not getting a ton of fiber or not getting enough fiber, which most, Western diets aren't, a supplement is totally, you know, reasonable to
And
it.
what kind of supplements? Wait, is that later? I don't want to take your question.
I don't think we have one, but I used to tell people take Metamucil or Benefiber or Cetracell or Consul or all these different types of like powdered fibers that you can stir into your water and it turns into a
Mhm.
gel. And but then people would be like, "Oh, I hate doing that every morning. It's gross. I stir it into my coffee," which to me is like a little bit like, counter-effective, and because you're dehydrating yourself at the same time. So it's like, so now I tell people either do a little bit of Metamucil in a glass of like in a half a glass of water and then chug another glass of water after if you want to do the fiber. But otherwise, if you do Metamucil pills, for example, or a similar psyllium husk pill, they come in capsules, but you have to take like five of them for like, 5 grams of fiber, which some people prefer. And most recently, I've been recommending gummies, which I used to hate gummies, but now that I've found a couple types of gummies that have, the 5 to 10 grams of fiber per serving, I think it's totally reasonable. People are more compliant with doing it. Like you pop a gummy in your mouth and you run out the door rather than trying to like stir up your little fiber drink. So fiber plus probiotics.
I think also on fiber pills, I use psyllium husk, love it. I take the pills, but you don't need to buy posh pills. People will rebrand them and sell them at a massively inflated price. Just generic psyllium husk, as effective as branded psyllium husks. So that's a tip to save money because they aren't necessarily cheap.
No, and you can actually get a really good like amount of psyllium husk or ground flaxseed or even chia seeds. Are those are my top three favorites. They can get at a health food store, get it in bulk, put it on your cereal, put it on your oatmeal, put it on your salads, put it on your soup. Like even just like a teaspoon to like a tablespoon a day is totally worth it.
Is there anything regarding like taking meds, taking your fiber at the same time as other meds that people should be worried about
Uh, I
as
mean, the
far
only
as
one
like absorption?
Yeah, so like the reason why people get upset about fiber pills and taking meds, it's I think the heart medication was called digoxin, and basically it sucks that drug into that gel matrix it makes in your colon, and then that drug can't get out. And obviously that's really, really bad
Yeah.
for a heart medication.
Yeah.
It doesn't do that with all drugs. It's actually quite rare, but
Yeah.
there was some worry initially around its use with PrEP. So basically, pharmacies after digoxin were like, if you're taking fiber supplements, you should always take them separately from every other drug in the world because that is the safest way. Actually, if you're a gay man taking fiber supplements in the morning and in the evening, and you also need to take PrEP, suddenly your schedule is a bit tricky because so many pills at different times. There is absolutely no evidence that fiber pills affect PrEP's effectiveness. So it's just something we shouldn't be worrying about.
Yeah. In general, I don't know that it's worth worrying about it at this point. Yeah. Yeah.
Perfect.
Otherwise, I'm telling people like, oh, take this, morning and night. And like you said, take this 3 times a day. And it's like too much. People won't do it.
Yeah, it's
I
hard to
had
keep track
someone
of.
Yeah.
I had someone on a call showing me their schedule of pills, trying to eat separately the fiber and the prep. And I was like, this is actually impossible. There aren't enough hours in the day for you to separate things. Yeah.
Oh, God.
Um, what's the actual risk of using temperature or of what's the actual risk of using water that's the wrong temperature, either too hot or too cold?
Um, yeah, so it damages the mucosa. There's mucosal injury. So too hot, it's going to burn it, and too cold, it will actually also cause the same trauma. It's the same as like if you put like an ice cube inside, you're going to cause some thermal injury to your mucosa.
And I mean, if that isn't warning enough, not to do it. The other thing I can tell you is 59% of gay men in the gay man sex studies say that they struggle with anal pain. If you use water that's too hot or too cold, you're probably going to make sex very painful for yourself. You should be doing everything possible during your douching session beforehand. Small tip, um, lukewarm water, body temperature, to make things as straightforward as possible. You're not causing yourself damage, epithelial damage, or rectal damage, so that when you have sex, you can enjoy it as much as possible.
Is that 59% like regardless of what you're doing? 59%?
Yeah, so 59%. I mean, I can't remember the exact questions they were asking, but it's the gay man sex studies. Anodyspareunia, so that's anal pain during sex, is unbelievably prevalent.
Yeah.
It's not classed as a disease, so it affects so many people. And also from surveys, I can tell you, in my mind, what we're doing at the moment, we're looking for the alternative to anal douching. The next thing we'll be looking for is how we make it less painful for people, because it trashes relationships because people feel like they can't have sex, they feel like there's something wrong with them,
Right.
etc., etc.
Because I mean, obviously, like women have dyspareunia, like a vaginal equivalent, but I don't know how prevalent that is. I imagine that's actually pretty high too. Interesting. All right, I'll think about that one. So somebody asks, they've tried douching a few times and it was messy. How do we improve that?
It's a great question. There's always room for improvement. I mean, I think depending on, what kind of mess we're talking about, you know, take a bowel movement before you try to douche, I think is number one. If you're douching and before you go poop, you're just adding to the poop and to the mess. And so, I think I can see that becoming messy pretty quickly. I would say on the other side though, like if it's a water situation, use less water, make sure you're over the toilet when you're inserting the bulb or the tip, and adding the water. Lay some towels down maybe. But
Where do y'all do it? What's the most common place? Like over the toilet, I would assume, but like on the bed, in the shower, you know, in the laundry room.
As a representative for messy bottoms, I can tell you that like the process is a nightmare.
it
Like
is. Yeah.
particularly when you consider like what necessarily like bathroom facility you have available. Straight people are always shocked when I explain to them that what you have to do normally is like fill up a sink with lukewarm water and then kind
Mhm.
of pivot between the sink and the toilet to do this. I think the first thing is to acknowledge that it's douching is a messy process. You're clearing out feces from inside of you. I think the other thing to know is that sometimes, like, I have a day where I'm like, oh, like, I want to have sex with my partner, but I'm like, you start douching and you're like, like, it ain't gonna happen today. And you just gotta, those days, when they happen, and you're like, you don't go through 25 rounds of trying to
Mhm.
clear it all out. You just do something else. There's so many more things you
Yeah.
can do in the bedroom aside from penetrative anal sex. You will have days when it's just not going to happen. Um, but aside from that, the other thing is biggest tip, fiber. That will keep the douching session short and it will short, sweet, out it comes, and back into the bedroom you go.
And I mean, I just want to say that like sex is a messy process. Like no matter how you go about it, like we don't want to admit it, but like sex isn't like the movies. It's not like, porn most of the time, it's super messy. Like there's fluids everywhere, there's sheets everywhere, and I think this just adds to the messiness for sure. But nobody's trying to have like super glamorous, like, well, I mean, maybe we are trying to have super glamorous sex, but
The reality is something different. Yeah.
But your point about the fiber, I just wanted to throw in there. Like, I think maybe we didn't say at the beginning, but the consistency of the stool is what's important. The fiber makes it firm enough so that it slides out, and just slides out. I was talking on a Conservation Nation live with my friend Ellen last night, and she calls it no wipe, no push poop. And so literally it comes out. And because your anal sphincter, closes after it, it's so nice and smooth. It's like you don't push, comes out, it's gone, right? That is the ideal poop because then you really are minimizing douching. If it's too watery, it's going to be a mess. And if it's too hard, it's going to be a mess. That's what fiber helps. Anyway,
Yeah,
so sorry. I am
Totally.
asking the next question. Okay.
No,
All
you're
right. So
good.
this next person really enjoys butt play, but not anal sex. What hygiene steps should they take for the butt play?
I mean, there's a good chance you don't need to douche at all if you're not, having penetrative, I can't even say the word, sex. If you're not having anal sex, like you probably don't need to have a full douching session. Like wet wipes, a bidet, a nice shower. I think some of those are probably sufficient for more shallow butt play.
I mean, I was going to say wash your hands.
Also wash your hands. Yeah.
Wash your hands and wash your toys.
yeah. Wash your toys and then leave them in a ventilated space to dry out. Never
Air
want
dry.
any
Yeah.
air dry, no mold growing in drawers. That's awful. Sorry, that's off topic, but um,
Because
I
then
think
where
also
does it go? Right up your butt.
another,
Yep.
yeah, yeah, literally it goes.
Yeah, exactly. You don't want a moldy butt.
I think also on that question, it's important to note that like whatever you're doing, you don't necessarily have to douche. Like
Yes.
there is like if you don't want to douche, don't douche. And like again on the previous question, like about messy bottoms, like bottoms go through quite a lot to prep themselves for sex. Like tops to an extent should be very grateful. If there is occasionally some feces, oh my God, like it's fine. Like we know what we're
You're a
doing.
human.
We know what we're
Right.
Yeah.
doing. No one should ever feel any pressure from a sexual partner, particularly a penetrative sexual partner, being like, oh, that's dirty. Like this kind of stuff is things I've heard people have had said to them, which they find really embarrassing. Mm-mm. Yeah,
No. I mean, you know
move.
what you're getting into. It's basically, occupational hazard, part of the territory, literally. Um, so yeah, the number of people I have, slightly off topic, who tell me that they have skin tags that their partner wants removed. And both men
Interesting.
and women. And I'm like, do it for yourself, 100%. Like, do not do it for anybody else. Like, skin tags is a whole different story. I know we're not talking about this here, but because we're talking about anal sex, and both men and women, they'll be like, okay, my partner does not want those skin tags back there. And I'm like, if they don't want that, you tell them have their skin tags removed, and then you have your skin tags removed. I'll still do it. And, it looks very pretty afterwards. I always tell people it doesn't look perfect, like a perfect little butthole, like the day you were born, but still better than before, but never do it for somebody else.
Your
All
body is
right.
yours. Yes.
Your butt is yours. All right. Okay. So I feel super insecure about douching. Any emotional tips?
I can tell you, we've interviewed over 200 people. I've done 200 in-person interviews about how people douche, how they're doing it. The first thing pretty much everyone has said is, I don't think I know what I'm doing. That's probably due to the lack of information that is out about how to douche. There's no, obviously, an LGBTQA plus sex ed is incredibly limited. It definitely does not stretch into the territory of how to douche. Um, so the first thing is realize that like kind of normal if you don't know what you're doing. And then look to people and guides online, specifically about how to do it and how to do it safely. Realize that accidents happen, and then nothing to be worried about.
I
I
agree.
mean, I
And I
guess
mean,
also. Oh no, sorry, you go first.
oh no, I was just gonna say, like, it's kind of what Henry was saying earlier, like douching is a personal choice, right? And if you're insecure or feeling insecure about it and like it's not the right move for you, don't do it. Do it at your own pace. And if you're with a partner that shames you for like a normal bodily function, then that's on them, really. So
What do you tell yourself? Like, what's going through your head, as you're preparing for like the douching process?
here we go. I'm just kidding.
That's probably true. That's just honest.
Yeah. I mean, it is work, right? Like you were saying, like it is a process. I think, I think for me, it's knowing what's coming after, like, or it's more of the headspace of that, like,
Hmm.
making sure that like the sex is kind of is something that it's something that I'm after. Like I want to be douching for me. And like because if you're not in the right headspace and like you're just kind of going through it, like it is gonna feel like a mess and like things just aren't going right, probably, right? And so that might be one of those days that we talked about earlier where find something else to do in the bedroom. But
Yeah.
I think that's me. It's less about like the douching piece itself and um maybe more
I,
about what's coming after.
I think it's just super valid that, maybe most people feel like they don't know what they're doing, with douching, or, very few people know or would claim they're experts, maybe.
Hmm.
It's like adulting. And so as a plug, right? So what you guys are putting out there is an anal douching guide ahead of Pride Month, both online and hopefully in print someday. That will be, a resource for people who have questions about douching and be like, hey, have you seen this? Like, have you tried this? Or like, these are the safe things to do. And I just think that needs to be out there. All right, next question. So I'm lactose intolerant and cleaning out is tough. Any hacks?
Chill on the lactose beforehand.
Don't eat that ice cream.
Yeah.
I mean,
But I mean,
that's
really, like
yeah.
if you know you're gonna have anal sex like, 24 or 48 hours like in advance, like don't have a bunch of dairy, like don't have the ice cream,
Yeah.
like
Don't have
be
the cheese.
mindful of your diet. And consider like lactate or something like that if you can't get around it, like some enzyme blocker, but or enzyme, but like don't don't overdo it on the dairy, would be number one.
Yeah, I was gonna say lactate for sure, and then, but what if you don't know it's coming up? Like you can't plan 24 or 48 hours in advance, and then you just had some cheese.
This is the burden of all of this
Right.
is that
Yes.
sex is spontaneous.
This is why
Yeah.
you're making what you're making.
Yeah, this is why we're looking for an alternative, which is
Yeah.
spontaneous, 30 seconds. Find out a month of plug about that in, I think, 2 weeks. We do pre-launch, so you can see what we're actually doing. But yeah, this is why it's difficult. But it's not just lactose,
Yeah.
it's fried food, kebabs,
Hmm.
like all of
Yeah.
these things. You don't want that coming through your system, probably at the same time that you're getting ready to go on a hot date that you weren't expecting.
Yeah, no, I would say, I mean, like, 24, 48 hours is taking the spontaneity out of it for sure.
Hmm.
But, whatever digestive enzymes, either BINO, right, which is alpha galactosidase, which helps with the gas and digest, complex carbs like beans and whole grains and things like that, or lactate, which is lactase, and that can digest the dairy. Those usually will help with that bloating, the gassiness, like it's more commonly diarrhea, but it can also be constipation. Like it helps with those stool symptoms if you're, need immediate relief and then, douche or don't douche after that. Is post-douching cramping normal?
So, I mean, one of the things, having spent so much time looking into the science of douching, it's literally my job, um, is that we don't know a lot. Um, I know so little about cramping. I only know it's a problem for some people. My current understanding of why people get cramps is one, people think it's because of incorrect water temperature, so either cold or hot water. And the other one is that people think cramping is due to water going beyond rectosigmoid, going up even higher, round the corner and maybe even back down the other side, particularly if you're using like a shower shot douche, so one of the ones that plugs into your shower. And they think the water is actually because it's trapped in different parts of your colon
Yeah.
and can't get back out. So my best advice for cramping is probably avoiding shower attached douches, putting in too much water or using the incorrect water temperature.
If anything lasts super long, obviously, go find a doctor. Like it shouldn't last a long time. Like shouldn't be cramping long term afterwards, or anything like that. But
Yeah, I was gonna say, or consistently cramping,
right.
every single time. That should not be happening unless you're truly doing something wrong. The only other thing I can think of is, really like pelvic floor trauma. Like if you're forcing something in, your body will have the response to spasm no matter what, right? Proctalgia fugax essentially is a rectal spasm, and so that could happen if you're having like either instilling too much water at a time. Fiber gummies and chia seeds. Is that a good combo? And which one is better? Oh, you talked about psyllium husk. That's right.
Yeah. And I do the psyllium husk powder and I just mix it in and chug it and then drink a bunch of water.
Good job, Andrew. Good for you. You guys come talk to my patients.
Did you guys see the I think it's called like the colon shower on TikTok, which is chia seeds in water with lemon juice? That's what
I
I thought was.
just saw that yesterday. Somebody sent me that. I guess it would work, you know? It's essentially the same thing. Although there was like a medical report a while back of like somebody who like just like ingested straight chia seeds and like 35 pounds of them or something, and they literally just sit there, right? And then become like an undigested like gelatinous mass. Because
Oh
like,
my God.
people will be like if a little is good, more is better. And well, don't do that. But like, I think the colon cleanse is a teaspoon in a glass of water with a squeeze of lemon, and that to me seems fine.
35 pounds. I can't even like
The
imagine.
I think the world record for stool is 42 pounds, and that's in the museum in Philadelphia, the Mutter Museum in Philadelphia.
It's probably also worth mentioning with like talking about colossal amounts of fiber that if you are just starting to take fiber pills, start slow.
Hmm.
And you want some people can get like quite bad stomach pain, I think, and also like or enormous amounts of flatulence, which no one probably wants. So that's probably good advice before you go out and buy your bag of chia seeds.
Yeah, no, and actually people will tell me, oh, I can't do the fiber. I get super bloated. I start farting all the time. And so I always tell people start like with a small amount. If it's the serving is two gummies, start with one, and your body will actually acclimate to it over the next 3 to 4 days, which is, really one bowel movement cycle within 1 to 3 days. And then by the next time, your body will be like, hey, we have the bacteria now to digest this, and we know what we're doing. Right. So keep at it. I usually tell people keep at it for at least a couple of weeks, if not a month, and you will notice a difference. But the first bag of broccoli, it's going to make you gassy, no matter what.
Broccoli will always make me fart, no matter what. Like no matter how long I've been eating
Really?
it.
Oh,
Yes, I like always.
you eat it
I
all the
find
time?
it oranges. Oranges, yeah, make me fart a lot.
That's
Anyway.
weird.
And
That's
popcorn.
not,
Popcorn also makes me fart, which is really random, but
wait, that is super random.
I don't know. Who knows?
For me, it's sweet potatoes, but like sweet potatoes
Yeah,
are
that makes
tasty
sense.
at least. But no, that's why I was saying, do you eat broccoli a lot? If you eat it every day, I bet you wouldn't fart as much.
Not every day, like once a week though.
Okay. And technically, oranges are a low FODMAP food, and they usually don't, have any gas promoting bacteria to it, which is kind of interesting, like oranges. I don't know.
Oh my God, maybe we should put out a survey of like what foods make you fart just to see like what the different ones are that make people
Because,
gassy.
like stone fruits are high FODMAP, like so like peaches, pears, plums, cherries. Sorry, peaches, plums, cherries, not pears. Or like things like, alliums, like onions and garlic, obviously. But I don't know that oranges might. You're just special, Henry.
Yeah.
Oh, no.
Oranges. Oh,
Special
I
in all the
love
ways.
oranges. Orange juice is one of my
Oh.
favorite things.
I
Art
love that.
and poetry.
So we want to say thank you so much to all our community for submitting their questions and engaging with us. We'd like to tease for you a lot of what we talked about is actually being put into a douching guide, which the cheeky charity Polari Labs and Carmen are doing as a collective. So you have these tips about douching in a very clear format that should be easy for you to follow going forwards. I'd like to invite everyone to follow, share, and keep the conversation going with us. Keep sending us questions. We'll try to answer as many as we can. Looking forwards. So thank you so much, Carmen, and also Andrew, for coming and talking with us all together. It's been
Thank you
great.
too so
All about
much.
douche.
This is so good for the community. So
Yes. Any chance to talk about butt stuff, I'm here for it.
love it.